So our Body Works Sports Physiotherapy with Holly here, who's a high-level field hockey player, and she's got some tightness in her hip flexors. So we're going to do some pressure point release with a pressure point ball in the front of her hip, in the psoas muscle or hip flexor muscle. So Holly's going to bring the ball down and bring it in front of her hip, just in front of her hip bone area, which will feel like when you put your hands down to your hip bone. And you'll find a pretty tender and tight spot there. And in this position, we want to be careful not to overarch the back. So Holly's come down and resting her forehead on her hands to take some stress off her lower back, and just using pressure in the hip at the front to try to help it release. Now you might need to move around a little bit to find the right spot, to be sure that you feel a tender spot. That's usually where it's tight is tender. In this case, move away from any pulse feeling that you have there, so to be sure that you're not putting any pressure on an artery. Pretty rare to do that, but just to be safe. And then once you've found that the pressure is releasing things, doing just a little bit of movement. In this position, it's a little awkward to do too much rolling on the ball, but a little bit of movement forward and back just to try to get the muscle to let go and release. And again, you would do this probably for a minute or a minute and a half or 2 minutes, depending on how long it takes you to have that muscle let go and relax a little bit. Usually that would mean that it's less tender when you're rolling on it. If you have any other questions, just give us a call at Body Works Sports Physiotherapy.